Hello. Hello, teacher. My name is Rodrigo Galvez. I going to present about mammoplasty. The introduction. The introduction mammoplasty. Mammoplasty is any type of surgical procedures aimed at chopping the patient's breast. The main objective is to change the shape of the breast. In cases the basis of the intervention is to maintain the natural morphology of the breast, whether for aesthetic or for yet are procedures that are currently safe and more common. Mammoplasty is prim- primarily a type of cosmetic surgery. However, in many cases, it is performed for that reason. This is because the are cause in which the volume or shape of the breast cause difficulty that may also be psychological psychological reasons. Yes. So, surgical technique or shape the breast have been practiced since 1895. The first breast implants died back to 1962. However, this type of procedures began to become popular in the 1980s. The popularity. Mammary glands. The mammary glands of a woman are called breasts. They are milk secretion organs located in the breast. In the breast, they are made of up of glandular tissue, blood vessels, lymphatic ducts, and nerves. Adipose tissue is the one that gives the breast its shape of it is the one that gives it a soft volume. Likewise, the shape of the breast is determined by the elasticity of the skin. As the years go, as the years go by, the glandular tissue begins to be replaced by adipose tissues. This why the breast become more flaccid with time, with aging. The upper part of the breast empties and this leads to sanguine sanguine. Next. What is operated is the area above or below the pectoral major muscle or B loves the brass tissue. The breasts do not contain muscle tissue as such. Therefore, it is not possible for them to increase in size through exercise. Characteristics. Mammoplasty characteristics are classified as major surgery. This means that they require general anesthesia as it is a lengthy procedure. It also involves a recovery time of the of at least 2 to 3 days. In all cases, mammoplasty leaves a scar. However, she tried to reduce its visibility as much as possible. The incision is usually made around the aureola. It is performed by making vertical lines which usually disappear with time. In some cases, the incision is made the hairpins where it is even less noticeable. Type of mammoplasty. The type of mammoplasty. There are several types of mammoplasty depending on what patient or needs. Talking about pathologic problems, so they can be for aesthetic or for jet. We can find four types: breast augmentation. Breast augmentation is conceived or of inserting an implant under the breast tissue or pectoral major muscle. Each implant has a certain size and shape. Some are rounded and others have a shape similar to a teardrop. Breast reduction. Breast reduction. Breasts that are excessively large for the size of the body cause various medical problems, among them muscle, bone, and respiratory pain. The procedures involve the removal of glandular and fatty tissue. Breast lift up or mastopexy. Breasts lose their forms and shape due to different factors such as age, pregnancy, or breastfeeding. Mastopexy is a surrogate to live at the breast and retrieve them but only for a while. It also allows to reduce the size of the areola. E4 breast reconstruction. The breast reconstruction breast utilizes several plastic surgery techniques to restore a breast to near normal shape and appearance following mastectomy. It is performed with an implant with breast tissue or without commonly the techniques to perform is a very solid give excellent results. To perform mammoplasty or waist takes into account the state of health of the patient both in physical and psychological terms. Ideally, women should be thoroughly informed before the intervention and go to a professional they trust. Thank you.